For every man over 65, what I'm about to reveal isn't just information, it's a lifeline. Imagine a life free from the constant dread of nighttime bathroom trips, the frustrating struggle to start or stop urination, or that nagging feeling your bladder is never truly empty. Many American men are unknowingly sabotaging their prostate health with daily habits that seem harmless, but are silently paving the way for years of discomfort and suffering. As a doctor, Juliana, I've witnessed firsthand the profound impact these often overlooked choices have. Today, I'm pulling back the curtain on the 10 most dangerous habits that could be silently enlarging your prostate. And trust me, number 1 on this list is so incredibly common, you're likely doing it right now without realizing the damage it inflicts. The common symptom of an enlarged prostate, such as waking up multiple times at night to urinate, difficulty with urine flow, or the sensation of incomplete bladder emptying, are often dismissed as mere signs of aging. However, this couldn't be further from the truth. While age is a factor, there are pervasive, everyday habits that dramatically accelerate this process. I've seen countless men arrive at my clinic in despair, some even experiencing complete urinary retention, all because they chose to ignore these early warnings for years. Yet I've also had the privilege of treating 80-year-old men who live entirely free from prostate discomfort, simply because they embrace timely lifestyle changes. The stark difference between these two groups lies not in their genetics, but in the seemingly small details of their daily lives. Understanding these critical distinctions is the first step toward reclaiming your health and ensuring your golden years are truly golden, not plagued by prostate issues. This isn't about drastic, unsustainable overhauls. It's about making informed, gradual adjustments that accumulate into profound, lasting benefits. By recognizing and addressing these silent destroyers, you empower yourself to prevent future suffering, enhance your quality of life, and maintain your independence. It's time to shift from passively enduring symptoms to proactively nurturing your well-being. The practical implication of this knowledge is immense. It transforms you from a passive recipient of potential health problems into an active participant in your own care. Each small change you make, each conscious decision to adopt a healthier habit, is an investment in your future comfort and vitality. It means more uninterrupted sleep, greater freedom in your daily activities, and the peace of mind that comes from knowing you're taking concrete steps to protect one of your body's most vital organs. This isn't just about avoiding pain. It's about embracing a fuller, more vibrant life. Habit 10. Drinking too little water. Many older men fall into this trap, mistakenly believing that limiting fluid intake will reduce those inconvenient nighttime trips to the bathroom. However, the exact opposite often occurs. When your body isn't adequately hydrated, your urine becomes significantly more concentrated and acidic. This highly concentrated urine acts as an irritant to both your bladder and, by extension, your prostate. Remember, your prostate gland is nestled directly below your bladder. Therefore, any distress or irritation experienced by the bladder inevitably impacts the prostate. This chronic state of irritation leads to inflammation, and inflammation is one of the primary drivers of prostate enlargement. Furthermore, many men in this age group are on medications that can inadvertently contribute to dehydration, further exacerbating the problem. A dehydrated body is also less efficient at flushing out toxins, leading to a buildup that overloads the entire urinary system. Over time, this subtle yet persistent damage manifests as an enlarged prostate and a worsening of urinary symptoms. The solution to this seemingly simple problem is remarkably straightforward. Drink water in small sips throughout the day. Don't wait until you feel thirsty. Thirst is often a sign that you're already partially dehydrated. A good rule of thumb is to observe your urine color. It should be clear, or at most, a very light yellow. This indicates optimal hydration. Distribute your water intake evenly, perhaps a glass every hour or two, rather than trying to chug large amounts at once. Keep a water bottle handy as a constant reminder. Consider setting small alarms on your phone to prompt you to drink if you tend to forget. Don't fear water. It is not your enemy when it comes to nighttime urination. It is, in fact, your most powerful natural ally against prostate problems. Adequate hydration helps to dilute your urine, making it less irritating, and supports the efficient functioning of your entire urinary system. It assists your kidneys in filtering waste products and keeps your bladder and prostate less inflamed. Think of it as regularly flushing out your system, preventing stagnation and irritation that can lead to the long-term issues. The practical implication here is profound. By simply increasing your water intake, you're actively reducing the inflammatory burden on your prostate. This isn't just about preventing enlargement. It's about promoting overall urinary tract health, potentially reducing the risk of infections, and making your body's waste removal processes more efficient. A well-hydrated body functions better at a cellular level, and this seemingly small habit can contribute significantly to your overall comfort and well-being, translating into fewer bothersome symptoms and potentially better sleep. Habit 9. Sitting for hours. I know after 65 that favorite armchair or sofa starts to look incredibly inviting. The thought of getting up can sometimes feel like a chore. However, spending prolonged periods in a seated position could be harming your prostate much more than you realize. When you remain in the same position for extended durations, particularly when seated, it creates a constant, unyielding pressure on your pelvic area. This sustained pressure significantly reduces blood flow to the prostate gland. When blood flow is restricted, oxygen and vital nutrients cannot reach the prostate tissue effectively, leading to cellular stress and ultimately inflammation. Inflammation, as we discussed, is a key factor in prostate enlargement. Men who spend their entire day watching television, reading, or working at a desk are at a considerably higher risk of developing prostate issues. It's not about avoiding rest or leisure. It's about breaking up long periods of inactivity. Furthermore, your pelvic floor muscles, which play a crucial role in bladder control and emptying, tend to weaken when inactive. This weakening can make it harder to fully empty your bladder, leaving residual urine behind. Stagnant urine in the bladder is a breeding ground for bacteria and a constant source of irritation to the prostate. The good news is that the remedy for this habit is incredibly simple and requires minimal effort. Stand up every 30 minutes and walk for at least 2 minutes. This brief period of movement doesn't need to be an intense workout. It could be as simple as walking to the kitchen for a glass of water, tying back to habit 10, taking a short stroll around your living room, or simply standing and stretching. The key is to break the continuous pressure on your pelvis and stimulate blood circulation. Regular, gentle movement helps to alleviate pressure on the prostate, encourages healthy blood flow, and keeps your pelvic floor muscles more engaged. Consider setting a timer or using an app as a reminder to take these short movement breaks throughout your day. Don't allow a sedentary lifestyle, however comfortable it may seem in the moment, to evolve into a significant health problem down the line. Your prostate, and indeed your entire body, thrives on movement. These small, consistent breaks help reduce chronic inflammation, improve muscle tone in the pelvic region, and ensure better bladder emptying. This simple habit can significantly reduce the risk of prostate enlargement and alleviate existing urinary symptoms, paving the way for a more active and comfortable life. The practical implication of integrating movement into your day is that it empowers you to actively counteract the negative effects of prolonged sitting. It's a proactive step that requires minimal effort but yields significant dividends for your prostate health. By keeping your blood circulating and your pelvic area less constricted, you're fostering an environment that discourages inflammation and promotes the healthy function of your urinary system. This small adjustment can lead to a noticeable reduction in bothersome symptoms, ultimately enhancing your overall quality of life and sense of well-being. Habit 8. Excess caffeine. Brazilian coffee is often considered sacred, and for good reason. It's a delicious part of many people's routines. However, indulging in too much coffee, along with other caffeinated beverages like certain teas, sodas, and energy drinks, can irritate your prostate more than you might realize. Caffeine is a potent natural diuretic, meaning it increases urine production, thereby putting an extra burden on your bladder. For someone with a sensitive or already enlarged prostate, this increased volume and frequency of urination can be a real problem. But its impact doesn't stop there. Caffeine also stimulates the muscles surrounding the bladder to contract more frequently, leading to feelings of urgency and, in some cases, even leakage. This constant contraction and pressure directly affect the prostate. What's more, caffeine can also cause the muscles at the bladder neck to tighten, making it more difficult for the bladder to empty completely. The cumulative result is more urine retained in the bladder, increased pressure on the prostate, heightened inflammation, and greater discomfort. This constant irritation from overactive bladder muscles and incomplete emptying can exacerbate prostate enlargement over time. I'm not suggesting you abandon your morning cup of coffee entirely, but moderation is undeniably key. 1 cup in the morning typically doesn't cause significant issues for most men. However, consuming multiple cups throughout the day can certainly be harmful. A good strategy is to gradually reduce your daily caffeine intake. Try replacing your 2nd or 3rd cup of regular coffee with decaffeinated coffee, herbal tea, or simply plain water. Pay close attention to how your urinary symptoms respond. You might be surprised at the improvements you observe. For example, some men find that switching to green tea, which has a lower caffeine content and beneficial antioxidants, is a good compromise. Sometimes small adjustments like these can make a remarkably big difference in alleviating bothersome urinary symptoms. By reducing your caffeine consumption, you give your bladder and prostate a much-needed break from constant stimulation and irritation. This can lead to less frequent urination, reduced urgency, and a more comfortable overall urinary experience. It's about finding a balance that allows you to enjoy your favorite beverages without compromising your prostate health. The practical implication here is about regaining control over your urinary patterns. By reducing caffeine, you're directly lessening the load on your bladder and prostate, which can translate into fewer trips to the bathroom, especially at night. This simple dietary adjustment can significantly improve your sleep quality, reduce anxiety related to urinary urgency, and contribute to a more peaceful daily life, free from the constant thought of where the nearest restroom might be. Habit 7. Overly spicy and processed foods. Brazilian cuisine, renowned for its vibrant flavors, often incorporates a generous amount of spice. While a little zest can be delightful, an excess of very spicy and highly processed foods could be silently harming your prostate. These types of foods are notorious for causing systemic, often silent inflammation throughout your body. Ingredients like excess black pepper, hot sauces, and strong chili peppers can increase overall bodily inflammation, including in the delicate tissues of the prostate. While an occasional spicy dish isn't typically a problem, daily consumption can chronically irritate an already sensitive prostate gland. Processed foods, however, are even worse offenders. Items like chips, cold cuts, such as sausage and ham, frozen meals, and fast food are loaded with artificial preservatives, colorings, excessive sodium, and unhealthy fats, trans fats, and saturated fats. These ingredients not only harm your overall health, but also throw your hormonal balance into disarray. For example, excess salt leads to fluid retention, placing additional pressure on your entire urinary system. Bad fats and chemical additives can negatively affect testosterone levels, a hormone that directly influences the size and health of the prostate. If your typical meals come more from packages and drive-thrus than from fresh, whole ingredients, your prostate could indeed be paying a heavy price. The key to counteracting this habit is to prioritize natural, anti-inflammatory foods and minimize your intake of processed items. Focus on incorporating plenty of fresh vegetables, fruits, lean proteins like fish and chicken, grilled or baked, not fried, and healthy fats found in nuts, seeds, and olive oil. These foods are rich in antioxidants and vital nutrients that actively combat inflammation in the body. You don't need to completely eliminate all spicy foods, but practice moderation. Try replacing high-sodium processed meats with fresh, unprocessed alternatives. Experiment with herbs and spices that offer flavor without the intense irritation, like turmeric, ginger, or oregano, all known for their anti-inflammatory properties. A healthy diet doesn't have to be bland or boring. It just needs to be balanced and focused on whole, nutrient-dense ingredients. By reducing your intake of inflammatory and processed foods, you provide your body, particularly your prostate, with the essential building blocks it needs to heal and thrive. This dietary shift can significantly reduce prostate irritation and inflammation, contributing to better urinary function and overall well-being. The practical implications of this dietary shift is a profound improvement in your body's internal environment. By choosing natural anti-inflammatory foods, you are directly nourishing your prostate and reducing the systemic burden of inflammation. This means not only better prostate health, but also improved cardiovascular health, better weight management, and enhanced overall vitality. It's a holistic approach that impacts multiple aspects of your health, leading to a more energetic and comfortable life, free from diet-induced irritation. Habit 6. Holding in urine. We've all done it. Holding in urine because we're too busy, stuck in traffic, or simply far from a restroom. However, making this a regular habit can cause serious, long-term damage to your prostate. When you consistently hold your urine for extended periods, your bladder stretches beyond its normal capacity. This overstretching causes the bladder to press forcefully against your prostate gland, which is situated directly below it. Over time, this repetitive pressure leads to irritation and swelling within the prostate tissue. Older men are particularly vulnerable to this habit because the muscles controlling the bladder and prostate naturally weaken with age. This makes it harder for the bladder to withstand the pressure of retained urine, and for the prostate to recover from the constant compression. Furthermore, holding urine can lead to incomplete emptying of the bladder, leaving a significant amount of stagnant urine behind. This residual urine creates the perfect, warm, moist environment for bacteria to multiply, dramatically increasing the risk of urinary tract infections, UTIs. UTIs, in turn, cause further inflammation and irritation to the prostate, directly contributing to its enlargement and worsening symptoms. To safeguard your prostate and prevent these detrimental effects, the solution is straightforward. Listen to your body's signals and empty your bladder as soon as you feel the need. Don't delay going to the bathroom, especially if you already experience symptoms like interrupted sleep due to urination or a strong sense of nighttime urgency. Make it a priority to find a restroom promptly. For many men, this might mean planning ahead when leaving the house or during long car rides. It also means resisting the urge to just finish one more thing before heading to the toilet. Going as soon as you feel the need is one of your best defenses against prostate problems. Remember, your bladder and prostate work as a team. If one is under undue stress, the other will inevitably feel the repercussions. By consistently emptying your bladder fully and promptly, you reduce internal pressure, minimize irritation, and lower your risk of infections. This habit promotes healthy bladder function and gives your prostate the space and environment it needs to remain healthy. The practical implication of this simple act is immense. By respecting your body's signals and emptying your bladder promptly, you're actively preventing chronic pressure and inflammation on your prostate. This means a reduced likelihood of developing or worsening bothersome urinary symptoms, fewer trips to the emergency room for severe urinary retention, and a significantly lower risk of painful and debilitating urinary tract infections. It's a habit that directly contributes to your daily comfort, autonomy, and long-term prostate health, allowing you to live with greater ease and confidence. Habit 5. Smoking or being around. Smokers. Cigarettes are unequivocally one of the worst enemies of your prostate, and indeed, your entire body. Even if you're not a smoker yourself, regular exposure to secondhand smoke is also significantly harmful. The thousands of toxic chemicals found in tobacco smoke profoundly impact your circulatory system, reducing blood flow throughout the body, including to the delicate tissues of the prostate. This impaired blood flow starves the prostate cells of oxygen and nutrients, leading to cellular damage. Simultaneously, these chemicals dramatically increase inflammation throughout the body, creating a chronic inflammatory state that directly contributes to prostate enlargement and dysfunction. Smoking also significantly elevates oxidative stress, which is an imbalance between free radicals and antioxidants in your body. This imbalance weakens your body's natural ability to repair damaged cells and tissues. Over time, this cumulative damage leads to prostate inflammation, gland enlargement, and a substantially higher risk of developing prostate cancer. For older men, the cellular damage and inflammatory processes accumulate much more quickly due to years of exposure. Tobacco also depletes essential antioxidant levels in the body, further weakening your natural defenses against prostate issues and other chronic diseases. Even if you quit smoking years ago, regularly being around smokers can still allow these toxins to enter your system and negatively affect your health. If you currently smoke, the most powerful step you can take for your prostate and overall health is to talk to your doctor about ways to quit. There are numerous effective support therapies available, including nicotine replacement products, patches, gum, prescription medications, counseling, and even natural treatments or behavioral strategies that can significantly help you overcome this addiction. The benefits of quitting begin almost immediately. Within a few weeks, your circulation improves, inflammation starts to decrease, and your body's repair mechanisms kick into gear, allowing your prostate to begin its recovery process. If you have never smoked, it is absolutely crucial to avoid exposure to secondhand smoke altogether. Politely but firmly distance yourself from smoky environments. This seemingly simple decision to eliminate or avoid smoke exposure can literally guarantee you years of better prostate health, reducing your risk of enlargement, inflammation, and even prostate cancer. It improves your overall cardiovascular health, lung function, and vitality, allowing you to enjoy a much higher quality of life in your later years. The practical implication here is that addressing smoking or secondhand smoke exposure is one of the most impactful decisions you can make for your prostate. This isn't just about reducing risk, it's about actively reversing damage and creating an environment where your prostate can heal and function optimally. The benefits extend far beyond your prostate, encompassing improved breathing, more energy, and a significant reduction in the risk of numerous life-threatening diseases, ensuring a longer, healthier, and more comfortable future. Habit 4. Avoiding doctor visits. Many men, particularly as they age, adopt a reactive approach to their health, only seeking medical attention when something is seriously bothering them or becomes unbearable. However, this is a dangerous and often regrettable approach, especially after the age of 60, when prostate health becomes a more significant concern. The prostate gland can enlarge silently for years, with no obvious or bothersome symptoms in its early stages. You might not feel any pain or notice any urinary changes until the enlargement is quite significant. Regular checkups with your doctor are absolutely crucial because they help detect potential problems early, long before they escalate into serious or debilitating conditions. A simple checkup, which often includes a discussion about your urinary habits and potentially a physical examination, like the digital rectal exam or DREE, and a blood test, like the prostate-specific antigen or PSA test, can reveal early signs of inflammation, infection, or abnormal growths that are not yet causing any pain or discomfort. Skipping these routine appointments means missing invaluable opportunities to act preventively. While some men feel uncomfortable discussing urinary issues or undergoing certain exams, the sooner you voice your concerns, the more natural and less invasive treatment options will be available. Delaying appointments can allow small, manageable problems to spiral into severe complications, such as acute urinary retention, where you can't urinate at all, or severe prostate infections, which often require urgent medical intervention. The solution is to make prostate health a priority in your annual checkup schedule. See your doctor at least once a year to discuss your prostate health, even if you feel perfectly fine. Be open and honest about any urinary symptoms, no matter how minor they may seem. Your doctor can assess your risk factors, recommend appropriate screenings, and provide personalized advice. Modern medical practices prioritize patient comfort and discretion, making these visits less daunting than you might imagine. Remember, these exams are quick, generally non-invasive, and can literally be life-saving. It's not just about gaining peace of mind, it's about embracing a powerful prevention tool. If a potential issue is detected early, lifestyle changes, such as those we are discussing in this video, are often sufficient to manage the condition without the need for medications, surgery, or more aggressive interventions. Don't wait for your symptoms to become unbearable or for a crisis to force you into action. Proactive preventive care is the smartest and most effective habit any mature man can adopt to ensure long-term prostate health. The practical implication of regular doctor visits is that you are actively engaging in preventive health care. This approach shifts you from a reactive stance, where you only address problems once they've become severe, to a proactive one, where potential issues are identified and managed early. This often translates into simpler, less intrusive treatments, better long-term outcomes, and significantly reduced anxiety about your prostate health. It's an essential habit for ensuring a long, comfortable, and independent life, free from the shadow of untreated prostate conditions. Habit 3. Eating red meat excessively. Red meat might be a beloved staple on many American dinner tables, but consuming it daily or in excessive quantities could be silently contributing to your prostate enlargement and other health issues. Numerous studies have consistently shown a strong link between a high intake of red meat, especially processed meats like bacon, sausage, hot dogs, and deli cold cuts, and increased inflammation throughout the entire body, including directly in the prostate gland. The saturated fats abundant in red meat, along with the chemicals and nitrates used in processing these meats, are major contributors to this inflammatory response. They can disrupt your hormonal balance, particularly affecting the delicate interplay between testosterone and estrogen, and significantly increase oxidative stress, an imbalance that damages cells and contributes to disease. In older adults, digestion also tends to slow down. Red meat takes longer for your body to process and digest, which can lead to feelings of sluggishness, contribute to weight gain, and increase pressure on the pelvic organs, including the prostate. This constant inflammatory burden and hormonal disruption create an environment where the prostate is more susceptible to enlargement and other problems. You don't need to become a vegetarian overnight, but significantly reducing your red meat consumption to once or twice a week can make a profound difference for your prostate health. Substitute red meat with leaner protein sources that are easier to digest and less inflammatory. Opt for fish, especially fatty fish like salmon, mackerel, and sardines, which are rich in omega-3 fatty acids known for their anti-inflammatory properties. Skinless chicken or turkey, grilled or baked, are excellent alternatives. Incorporate more plant-based protein sources into your diet, such as lentils, beans, and chickpeas, and tofu. Try preparing meals rich in fiber, like hearty lentil soups, bean chili, or dishes featuring a variety of vegetables. These dietary changes not only support optimal prostate health, but also improve digestion, promote a healthy weight, and enhance overall cardiovascular well-being. Your body will thank you with fewer urinary symptoms, more sustained energy levels, and improved prostate function in the long run. It's about making smart, sustainable choices that nourish your body rather than burdening it. The practical implication here is that by thoughtfully modifying your protein sources, you are directly reducing the inflammatory load on your prostate and promoting hormonal balance. This dietary adjustment can lead to a noticeable reduction in prostate irritation and a decreased likelihood of future enlargement. Beyond prostate health, these changes contribute to better digestion, improved heart health, and sustained energy, empowering you to live a more vibrant and comfortable life, free from the burdens of diet-induced inflammation. Habit 2. Carrying excess belly fat. As we age, accumulating extra weight, particularly around the waistline, is not merely a cosmetic concern. It's a significant warning sign and a major risk factor for developing serious prostate problems. Abdominal fat, often referred to as visceral fat, is not just inert tissue, it's metabolically active. This type of fat produces and releases inflammatory chemicals known as cytokines directly into your bloodstream. These chemicals circulate throughout your body, creating a chronic inflammatory state that specifically targets and irritates the prostate gland. This constant inflammation actively contributes to prostate growth and significantly increases your risk of developing troublesome urinary problems. Studies have consistently shown that men with larger waistlines are far more likely to experience an enlarged prostate, frequent nighttime urination, and even issues with erectile dysfunction. Furthermore, excess weight, particularly around the midsection, severely disrupts your hormonal balance. It can alter the delicate ratios of testosterone and estrogen in your body, both of which directly influence the size, function, and health of the prostate gland. An imbalance can lead to accelerated prostate growth. Physically, significant belly fat also exerts direct pressure on your bladder and other pelvic organs, further increasing the burden on your prostate. The solution isn't about embarking on a drastic crash diet, which is often unsustainable and can be unhealthy. Instead, focus on slow, steady, and consistent improvements to your diet and activity levels. Small, manageable changes accumulate into significant results. Start with a short daily walk, even if it's just 15-20 minutes. Begin by reducing your portion sizes slightly at each meal. Cut back on sugary drinks and highly processed snacks, which are often major contributors to abdominal fat. Losing even a few kilograms can lead to noticeable relief in urinary symptoms and overall prostate comfort. Prioritize whole, unprocessed foods and incorporate more fiber into your diet to aid digestion and satiety. Maintaining a healthy waistline, typically under 100 centimeters, approximately 40 inches, for men, is one of the best long-term strategies for robust prostate health. This not only alleviates physical pressure but also reduces systemic inflammation and helps rebalance your hormones. By actively managing your weight, especially belly fat, you empower your body to function more optimally, reducing your risk of prostate issues, enjoying a healthier, more active life. The practical implication of addressing excess belly fat is profound and multifaceted. By reducing visceral fat, you're not only easing the physical burden on your prostate, but also fundamentally altering your body's inflammatory and hormonal landscape. This translates into fewer urinary symptoms, a decreased risk of prostate enlargement, and improved sexual health. Beyond the prostate, losing abdominal fat significantly reduces your risk of heart disease, diabetes, and other chronic conditions, leading to a much higher quality of life, increased mobility, and a greater sense of well-being in your later years. Habit 1. Not managing chronic stress. This is perhaps the most ignored habit on our list, yet it is arguably the most dangerous. Chronic unmanaged stress is a silent, pervasive inflamer of the prostate and a significant threat to your overall health. When you live in a constant state of anxiety, tension, worry, or emotional pressure, your body continuously releases a cascade of stress hormones, primarily cortisol. While essential for short-term fight or flight responses, sustained high levels of cortisol have devastating effects. Over time, these hormones trigger widespread inflammation, cause chronic muscle tension, and create significant hormonal imbalances that directly impact your prostate gland. Stress tightens the muscles of the pelvic floor and around the bladder neck, restricting normal blood flow to the prostate and creating constant irritation. It also hypersensitizes the nerves around the prostate, making you more prone to discomfort and urgency. Furthermore, chronic stress severely weakens your immune function, making it harder for your body to fight off inflammation, infections, or cellular damage in the prostate. Older men often carry stress silently, internalizing financial worries, family issues, health concerns, and the anxieties of aging. All of this emotional and mental burden accumulates, leading to a physical toll. The result: more frequent urination, increased pain or discomfort, heightened urgency, and exacerbated prostate swelling. But here's the truly good news. You absolutely can manage chronic stress, and doing so can profoundly impact your prostate health. Simple, consistent habits can drastically reduce your stress levels. Incorporate daily deep breathing exercises into your routine. Just 5 to 10 minutes of slow, diaphragmatic breathing can calm your nervous system. Engage in light to moderate exercise consistently, such as walking, swimming, or cycling. Physical activity is a powerful stress reliever. Practice stretching or gentle yoga to release muscle tension. Even 10 minutes of quiet solitude or meditation a day can make a world of difference. Seek out laughter and social connection. Strong social bonds are protective against stress. Prioritize quality sleep, aiming for 7 to 9 hours per night. These activities are not just about feeling good. They are powerful medicine for your body and, crucially, for your prostate. Managing stress isn't just about emotional well-being. It's about healing your body from the inside out. This single change, often overlooked, can be the most powerful step you take today toward naturally reducing your symptoms and potentially halting prostate growth. It helps relax pelvic muscles, improves blood flow, and strengthens your immune response, allowing your prostate to function more healthily. It is truly the most impactful habit for a healthier, more comfortable life. The practical implication of effectively managing chronic stress is a profound shift in your body's internal environment. By reducing the constant flood of stress hormones and promoting relaxation, you're directly alleviating inflammation and tension in your pelvic area, leading to a healthier prostate. This means a noticeable decrease in urinary symptoms, better sleep, and an improved overall sense of well-being. It empowers you to live with greater peace of mind and resilience, transforming your daily experience and ensuring that your later years are characterized by comfort and vitality, rather than the silent burden of stress-induced health issues. Your next steps. A call to action. Now that you are fully aware of these 10 habits that can silently enlarge and harm your prostate, the crucial question remains: what will you do starting today? These aren't minor suggestions. They are powerful, actionable steps that can prevent months or even years of discomfort, sleepless nights, and the need for potentially invasive medications or procedures. If you are over 65 or even approaching this age, the time to act is truly now. Don't wait for your symptoms to worsen to the point of being unbearable or debilitating. Begin by committing to changing just one habit this week. Pick the one that feels most manageable, or the one you believe is having the greatest impact on your health. Perhaps it's simply making a conscious effort to drink more water throughout the day. Or maybe it's setting a timer to stand up and walk for a few minutes every half hour. It could be saying no to that extra serving of bacon at breakfast, or taking 10 minutes for some deep breathing before bed. Every single action, no matter how small it seems, truly matters and contributes to the bigger picture of your prostate health. Understand that your prostate won't heal overnight. This is a journey that requires consistency and patience. However, with the right habits applied consistently over time, your body possesses an incredible capacity to do wonders. It can begin to heal, reduce inflammation, and function more effectively. Remember, you are absolutely not alone in this journey. Millions of men face similar concerns, but with the right information and a commitment to these positive changes, it is never too late to start taking proactive care of yourself. Take care of your prostate, and it will in turn take care of you, allowing you to enjoy your golden years with vitality and comfort.